All right, health assessment. The first thing I'm going to do is gather my supplies. And right here I have my stethoscope and my pen light right here. I'm going to knock on the door. I'm going to enter the room. I'm going to shut the door to provide privacy for my patient and perform hand hygiene. I'm going to introduce myself. Hi, Stassi.
Hi.
My name's Brittany, and I'm going to be your student nurse today. How are you doing?
Good.
Good. Well, I'm here to do a health assessment on you. Basically, I'm going to do a quick checkup, look you over from head to toe using my stethoscope and my pen light, my hands. Does that sound okay with you? Okay. Can you give me your full name?
Stassi Nicole Howard.
Good. And what's your birthday?
July 5th.
Good. Can I check your wristband to verify? And Stassi Howard, July 5th, 2014. Okay. Can you tell me where you are today?
In my mom's bedroom.
Good. And can you tell me about what time of day it is? Is it morning, noon, evening?
Close tonight.
Close to night. Good. Do you know what year it is?
2021.
Very good. Okay, so my patient is alert and oriented to person, place, and time. Okay. I'm looking at her psychosocial, and she's very agreeable, in a good mood. She's moving around. She's fine with this assessment. Do you have any allergies?
Allergic to peanuts.
You're allergic to peanuts? What happens when you eat peanuts?
My cheeks swell up.
Your cheeks swell up. Okay. All right. Do you take any medicine for your allergies?
Can't remember.
Is it pink medicine?
Probably.
Okay. Is it called Benadryl?
Yeah.
Yeah, we do take that. No. Okay. And then I'm going to assess her vitals. So I'm going to take her blood pressure, her temperature. I'm going to check her pulse. And I'm also going to check her respiration rates. And now I'm going to, do you take any medications regularly? No, okay. So now I'm going to begin the head to toe assessment. I'm going to perform hand hygiene. And then I'm going to ask my patient, before we get started, do I have permission to touch you? Okay. So the first thing I'm going to do is work from your head, and then we're just going to move down to your toes. I'm inspecting the head, and I'm looking at the face. Now, her face looks symmetrical. I don't see any evidence of swelling or drooping, any lesions. I'm looking at her lips, and they're a nice pink color, so she seems to have good circulation to her head. And yeah, no jugular vein distension of any kind. So I'm going to go ahead and start palpating. So it's okay if I touch your head, right? Go ahead and palpate. I don't feel any indentions, any lesions. I don't see any.
Nice.
Feels nice. I don't see any infestations. I'm going to go ahead and check her lymph nodes next. I'm going to start with the back of the neck, the cervical, work my way to the mandible. Here we go. Nice gentle touch. A good, nice warm temperature. And good. I'm going to also palpate your carotid artery. Very nice. Okay. So the next thing I'm going to do, Stassi, is I'm going to take my pen light and turn it on. I just want you to look straight ahead. Very nice. I see some pupil restriction right there. Okay. So the next thing I want you to do is take a look at my finger. Keep your head nice and still. And without moving your head now, I want you to look at the wall behind my finger. Very good. You all right? Okay. Now I want you to keep your head still and follow my finger. You ready? Good. All 6 fields of gaze doing very well. So I just tested her cranial nerves, her oculomotor, abducens, trochlear, and everything seems okay. Can you bite down for me? Good. Can you swallow? Very good. Can you puff out your cheeks? Smile. Good. Open your mouth. Close it. Very good. Can you move your head side to side? Very, very good. Okay. So I'm going to actually move on down to her chest and arms. I'll inspect the arms first. Skin nice and warm. Good perfusion. Good capillary refill. Squeeze my fingers for me. Excellent. Equal on both sides. Move your arms up and down. Very, very good. No lesions. I'm going to check your pulse. Radial. Ooh, I feel that nice and strong. I'd say a 2. Very good. Equal on both sides. Okay, and to keep her dignity, we're just going to pretend that she's got a gown on. I'm going to move this stethoscope to check her breath sounds in a systematic manner down in the front and the back.
Like breathe in and breathe out.
Yeah, so do that next. All right, Stassi, I'm going to place this stethoscope on your skin. And each time I place it on a part of your skin, I want you to take a normal breath in and a normal breath out. Are you ready? All right, go ahead. Very good. Nice and clear in the front. We're going to move to the back. I'm going to start on the same side. Very good, you remembered. I'm going to go under the shirt real quick to keep moving down. In and out. Very good. And now adventitious breath sounds nice and clear.
It's like a moon on the one.
The next thing I'm going to do is check her apical pulse for 1 minute. I've got my trusty watch here. I should have had it on. All right, Stassi, all you have to do is breathe normal.
Sometimes I have to take big breaths.
I hear that, nice and strong. Ready? Just relax. We had 88 beats a minute. 8 and 8. Very good. So at this time, Stassi, I'm going to have you lay down on your side and swing your legs up on the bed. We're going to take a look at your tummy. Are you comfortable? Scooch down just a tiny bit and slide over towards me so I can reach you a little bit better. Perfect. So I'm going to lift your little belly up. I'm checking her skin. I'm inspecting good color, no asymmetry, no bulging, no bloating of any kind. Inspect, and then I'm going to auscultate. I'm going to go in a systematic manner around the quadrants. Listen for your bowel sounds.
Very skinny.
All right, ready? Okay. Good, just breathe normal. I can hear those tummy sounds. Okay. And so then I'm going to percuss. No rigidity or any distension right there. It looks good. And then I'm going to palpate. Stassi, I'm going to take the tips of my fingers and feel around your abdomen. I want you to tell me if you feel any pain or tenderness where I'm touching.
Little.
No pain? Okay. Very good. And then I'm going to cover that up. Very good. And then for the sake of the test, I would pretend that she was in a gown and I would ask her to roll over on her side. Stassi, could you go ahead and roll onto your side? Good. And at this time, I would check the bony prominences and the skin for any lesions, any breakdown. I would check the sacral area for any redness, maybe even the peri area, and inspect that. And I don't see anything. And roll back onto your back for me, please. Thank you so much. Now, Stassi, do you have any trouble going to the bathroom, urinating, or pottying? No, everything's fine. How many? Do you go to the bathroom every day? Do you have a bowel movement every day?
Yes.
Okay. And when you pee, do you have any burning or tingling or any issues? No, nice and normal? Okay. Is there any discoloration to your urine? No. All right. And at this time, I'm going to move on past that and check your legs. I'm going to inspect the skin for lesions, tumors, rashes, scars, anything. I'm checking her color. It's true to her ethnicity. Check the temperature on her bare skin, and I don't see any issues with that. I'm going to go ahead and I'm going to take her socks off if you don't mind. Nice. Okay. Can you pull your toes towards your nose? Good. Now push down. Oh, nice and strong right there. Can I go ahead and check your pulses right here?
Can I tickle?
That tickle? Good. And the pedal pulse. So, oh, nice and strong tibial and pedal. So I'm not going to check the popliteal or the femoral because she's got good pulses down here and good color. I'm going to check your capillary refill. Very good. Can you bend your knee up and down? Oh, good job. So good musculoskeletal movement there. And what do we have next? Okay, so I just want to have you sit right here on the side of the bed. And I also wanted to know that when I checked her respiratory system and her lungs, I just wanted to note that I did not see any accessory muscle use when she was breathing. She seemed to be breathing nice and comfortably. No barrel chest or any issues with that. How do you feel? Are you dizzy? Okay, just see her for just a second. Okay. And so for that, I want to conclude my head to toe assessment. I found normal findings that a perfectly healthy looking little girl, and let's see if that is it. I'm going to perform hand hygiene, and then I'm going to document my findings. Thank you.